welcome to the Indiana University Student Outreach Clinic, or IU-SOC. We're delighted to have you join us today. As you enter the healthcare profession, you will learn that physical and occupational therapy often work closely together in a rehabilitation setting.
In this video, you'll learn the differences between the two, explore how the Student Outreach Clinic aims to provide interprofessional care to clients, and understand why learning these concepts now will enable you to become a collaborative healthcare professional in the future.
Hey, how are you doing today?
I'm doing all right, I guess.
Okay, have you ever been screened for physical therapy and occupational therapy?
No.
Do you mind if we ask you some questions and see
Sure.
if that'd be good for you? All right, so what's your primary reason for being at the clinic today?
I'm in a lot of pain. Oh, and plus I'm here to pick refills on my high blood pressure medication.
Okay. And I'm going to go through a series of these questions, and just based on your answers, we'll see if occupational therapy or physical therapy would be good for you, okay?
Okay.
You have any pain anywhere in your body, and does that pain limit what you can do?
Yes, sir.
Okay, and where is that pain at?
I have back pain and knee pain.
Okay.
Okay, so you have pain in your back and your knees. Does that keep you from doing anything at work or home?
Yes, ma'am.
Okay. And how would you rate the quality of your sleep right now? Is it good, fair, or poor?
Fair.
Okay. Is it difficult to fall asleep or stay asleep for you?
Yes, ma'am.
Okay, I'll write that down.
And then in the past month, have you fallen or do you feel unsteady on your feet?
Yes, sir.
Okay, is that due to the pain?
Yes, sir.
Okay. Okay, great. I think physical therapy and occupational therapy would be good for you, and we both would be able to have some things that could help you out. So we're gonna go speak with medicine and get a referral and get a prescription, and then we'll come back and speak with you and get you up to see us. Does that sound okay?
Okay, that's cool.
Okay,
Great.
I'll be right back.
All right.
Good speaking with you.
Thanks for talking with us.
You're welcome.
See you soon. So Jason, what do you think?
Well, I think after screening the client that we should definitely make a referral for them to see physical therapy because of his low back pain and feeling unsteady.
Okay, I think he'd benefit from seeing OT today too. He mentioned that his low back pain makes it difficult to fall asleep and to perform routine tasks at work.
All right, sounds good.
All right, let's go get a referral from medicine and then we'll go talk to Professor Pape.
Okay.
Okay.
Confusion in determining which patients are appropriate for physical or occupational therapy is common among students and even working professionals. Because of this confusion, a consensus document was created for students to use at IU-SOC. This document clarifies the scope of practice for each profession and helps students to determine which patients to refer to PT, OT, or both. You can access this document in your resources.
As you've just seen in our case study, one client can be referred to both OT and PT for the same reason, low back pain. However, each discipline's interventions with the client will look much different.
Referring now to the consensus document, you can see the difference between each discipline's goals, evaluation skills, and treatment skills that are used at IU-SOC. The goal of PT at IU-SOC is to improve movement and alleviate pain, identify health risk factors, and enhance function and mobility for a variety of neuromuscular, musculoskeletal, and cardiopulmonary conditions.
The goals of OT at the IU-SOC include assessing, screening, and evaluating the client's occupational performance, followed by intervention and/or education in the 8 areas of occupation, which include activities of daily living and instrumental activities of daily living, rest and sleep, education, work, play, leisure, and social participation.
The evaluation skills PT students use at IU-SOC are differential diagnosis of musculoskeletal and neuromuscular pain and movement dysfunction, as well as balance, fall risk, and posture and gait assessments.
OT students use the occupational profile to evaluate clients. Students use the profile to obtain the client's interests, patterns of living, values, needs, strengths, and concerns related to occupational performance. Students also use this tool to analyze and observe occupational performance.
Treatment skills PT students use at IU-SOC are posture and movement re-education, therapeutic exercise, functional mobility training, balance interventions, gait training with or without assistive devices, manual techniques for soft tissue dysfunction and neurological pain, modalities, treatment of disc protrusion and impingement, post-operative rehabilitation, pelvic floor rehabilitation, as well as home exercise program and self-care instructions.
OT students help treat patients using patient education and adaptive strategies. Patient education includes medication management, smoking cessation, sleep hygiene, self-care, home management, and workplace or community reintegration. Adaptive strategies include assistive technology, adaptive devices, energy conservation, ergonomics, modalities, and splinting for joint protection, mobilization, and improved occupational performance. The back pain case study in this document is illustrated in the video. You can look through other case studies or the consensus document to learn how OT and PT approach similar issues in different ways, including low back pain. Let's go back to our case study to see how the OT and PT students, along with a faculty supervisor, work interprofessionally to coordinate care for the client.
Hey, Professor Pape. We'd like to talk to you about a client we just saw downstairs.
Great, tell me about them.
Well, I definitely think that they would benefit from seeing PT today. Our goal would be to reduce their low back pain through posture and movement re-education, and also address their balance issues.
Okay, what about any OT needs today?
I do think the client would benefit from seeing OT today. We could educate him on ergonomics and energy conservation techniques to help him manage his pain throughout the workday. We could also develop a sleep routine to help him fall asleep and increase his daily function.
It sounds like you're both right that this client needs both occupational therapy and physical therapy referrals. So we'll need to coordinate OT and PT services along with the other disciplines, so we're providing him the best care we can today.
Okay.
Great, thanks so much.
As you can see, health professions provide interprofessional care to clients to best serve their needs and their goals. The consensus document is accessible anytime to you in your resource to help delineate and clarify how occupational and physical therapy approach and guide intervention.
We invite you to take a moment to review the consensus document to better understand the roles of PT and OT in client care. Thank you for taking the time to review this module, and we look forward to seeing you at IUSOC.